Hey people, first off, this was posted or updated on the 22nd of December 2020, just so that you know it's recent. I find it very odd. I spoke about dark winter and I spoke about smallpox and whatever, and I find it very odd that all of a sudden, smallpox is kind of being, not compared, but is in the same conversation piece as COVID-19. 300 years of smallpox epidemics in London can teach us about COVID-19. Infection with a small amount of virus can improve survival rates and might be a beneficial side effect of wearing masks. If you go on to read, researchers from Canada analysed London death records from 64 to 30. This uncovered the introduction of health measures, variolation and vaccination. Period ended with the last case of the fatal and scarring disease in the city. Variolation saw people inoculated with small amount of virus from the infected. The procedure, which had risks in its use against smallpox, was abandoned. Experts have said wearing masks may help safely variolate against COVID-19. I find it odd that smallpox is now being brought up. Just something for you to, as I said when I put up about dark winter, something to keep in mind, people, that this is now showing up. Let's see if this starts popping up here, there, and everywhere else. It's got charts here if you want to come across and see or read about it or whatever. There's studies. There was a portion in here. Where is it? Was it down here? Because I was showing you guys when I was talking about, oh yeah, this is the part that I wanted to show you. Hang on, let me get it. Oh, you motherfucker. I was telling you guys how when I was looking up on that shit, it ended up taking me back to the country that I was born in, which is Yugoslavia, which no longer exists. And what I had read then was that only 2 countries still had smallpox, the actual virus, which is the US or Russia. But what I found odd here is that it says all nations were asked to destroy stocks of the virus or hand them to high security installations in the US or Russia. It is feared terrorists may have got supplies from Russia in the 1980s. I wonder if they're going to palm it off, if the smallpox does show up here, there and everywhere, if they're going to palm it off saying that it came out of Russia. Hang on 1 minute, I'll get you the next thing. That last article brought me to here. Patterns of smallpox mortality in London, England over 3 centuries, right? And it goes on, my scroller won't work, damn it. Hang on, let me see if I can get it going. There it goes. And it goes on to pretty much, these are patterns and patterns. Giving you all of this information. This is about, like I said, smallpox, right? Introduction, the articles, heaps of information. If you go onto these little numbers, which are clickable, links if you want to search stuff. And I kept going, I was reading down, because as you can see, the picture, this is on the last article that I just showed you, right? So I kept on going down to see what else there was. I'm wondering if they're going to or if they have put anything in related to this bullshit into the vaccine, the flu, as we can call it. I mean, Christ, if you're getting a false positive for HIV, Lord knows what else is in the fucker, right? But I kept going down. Hang on. You want to come across and read all of this stuff. It's pretty informative. But I came down here where it's got references, because it's always good to check out what they used as a reference. And who do I find but Fauci? So I thought, all right, let's go and have a look at this. Which brought me back here, okay? And for those of you that have never seen this, because everybody watches different videos and whatever, and a lot of information gets passed up. This is the New England Journal of Medicine. You can see here, Anthony Fauci. Editorial was published on February 28th, 2020. Then we've got another date here, March 26, 2020. And it goes on to talk about the said flu, okay? The part that I want to get to without reading all of this here, and for those that haven't seen this before, I suggest you come across and read it. On the basis of a case definition requiring a diagnosis of pneumonia, the currently reported case fatality rate is approximately 2%. In another article in the journal, report mortality of 1.4% among 1,099 patients with laboratory confirmed COVID-19. These patients had a wide spectrum of disease severity. If one assumes that the number of asymptomatic or minimally symptomatic cases is several times as high as the number of reported cases, the case fatality rate may be considered less than 1%. This suggests that the overall clinical consequences of COVID-19 may ultimately be more akin to those of a severe seasonal influenza, which has a case fatality rate of approximately 0.1%, or a pandemic influenza similar to those in 1957 or 68, rather than a disease similar to SARS or MERS, which has had case fatality rates of 9 to 10% and 36 yada yada. So for those that missed it, there you have it about your flu. I mean, some of you already would know this, like I said, but I just found it odd, and what got me onto stuff more, I guess, was that the conversation about smallpox is now it's in the same topic thingy as COVID-19, right, as the flu. I mean, keep an eye on it, people. You know, I keep saying dark winter, dark winter, dark winter. If you don't know about dark winter, for those that don't know, Google it. It's not a movie. It's a military exercise. I just simply found it odd that smallpox is in the same article or topic of conversation as the flu. I mean, if this was an old article, I would say, well, okay, you know, fair enough, but it's not. It's new. Like I said, December 22nd, 2020. So, something to keep an eye on, people. Have a good one.